Hi, everyone. Welcome to the Concussion Discussion Series brought to you by Integrated Brain Centers. I am your host, Amy Zellmer from Faces of TBI. And today I am here with Dr. Jerome Lubbe from Thrive Neurohealth. And today we're talking about proprioception, visual therapy, and intentional movement can decrease anxiety in post-concussion syndrome. So welcome so much. I'm so happy to have you here today, Dr. Jerome.
Thanks for having me, Amy. I love being here. I love what you're doing. Thank you for having me.
Yeah. And I think this is such an important subject, the whole anxiety component around brain injury and post-concussion syndrome. The vast majority of people I meet deal with it. And I feel like the longer that they have gone on with symptoms and no treatment, the worse and worse it gets. So I'm excited to talk about this and just offer people hope that it really can be resolved. So I'll kind of let you take over and I'll hop in with any questions.
Oh, yeah, please. I have an identical twin brother, so I've lost the ability to be embarrassed or offended, so you interrupt when you need.
I didn't know that about you for some reason.
Identical twin brother, older brother, but it's interesting when you talk about anxiety and tying that in. I've been a patient for 22 years. I went to 21 specialists over 9 years. In the first 6 years of my marriage, I've been married 15 years, and spent over $100,000 to get a diagnosis, only to be told, well, we know what's causing it. We don't know what to do with it. So the only reason I became a doctor was because I couldn't find one that knew how to work on people like me. My undergrad is in digital animation and film. You don't go from film school to functional neurology, and I certainly don't fit the mold of what most people look like in the clinical space. But I've had a really interesting experience around like anxiety in these spaces of wrestling with that as a patient. But I've also had a very stark contrast and a very unique lived experience that I have a great relationship with my best friend, who's my twin brother, who happens to be a healthy version of what I look like. No head injuries, no migraine history, lower weight. So if everybody's always curious, I wonder what a healthy version of me would look like, I can FaceTime that person at any time during the day. So it's been a very interesting experience as both a clinician and a patient to wonder what it would look like to feel better when you have an actual visual model of that. So it's interesting. But, the reason that I picked the topic when you asked what I wanted to talk about, knowing Shane and all of the work that he does, Dr. Stedman and a lot of other great clinicians, is we see so much of the conversation in PCS and post-concussion syndrome with vision, with balance, with cognition, with memory, with sleep, with all these major factors. But I was thinking through what would be, for the time that we have, something really practical, really safe, and really helpful for working on that piece that a lot of times isn't covered, even in functional neurology practices, unless like mine. I have 7 therapists that work, licensed professional counselors and therapists that work in my clinic that co-manage with the cases because we deal with heavy stuff. It's not just fixing the brain. It's like, how do I decide how to work through this if this is my story for the next 2 decades, right?
Right.
I got over 100 full-blown migraines per calendar year for 20 years, and I'm already over 40 for this year. I have to navigate both the mental and emotional health side of things when I know structurally things are not where I would love for them to be. So when I was thinking through this, I was going, there's a really interesting thing that happens in the brain when you have a conversation where you take vision out of the equation, and also when you're talking about balance. So I wanted to kind of give you an idea and a metaphor and a comparison for what happens to anxiety when we think about it from a balance perspective, and what happens about anxiety when we think about it from a vision perspective. That way, it's not necessarily something where we're leading into the conversation of, I'm not a licensed professional counselor and you're not a licensed professional counselor, but in terms of giving somebody hope of going, is there a way for me to not only exercise my brain, improve my balance, but also maybe make an impact in this either low grade or high grade anxiety that's kind of part of the equation for me in PCS. So that's what I figured we'd talk about today, if that's okay.
Yeah. And, like I said, the vast majority of people I meet have dealt with anxiety. And I feel like it's only natural. Like you have all these symptoms. You got visual stuff, you got balance stuff, you got memory stuff. And then you have the trauma perhaps from what caused your injury, right? And you keep being told there's nothing wrong with you, or there's nothing we can do for you. You just have to give it more time. And I mean, I know my anxiety got worse and worse and worse as it went until I finally found functional neurology and we got all those symptoms under control. But it's so challenging. And so I'm really excited to hear what you have to offer us.
Sure. So here's a concept I want you to think through when we talk about anxiety that's very prevalent in our physiology and our physical experience when we have a head injury. And I've had two concussions and been hit by two drunk drivers before I was 21. So these are lived experiences that I've had to rehab from, and I understand. But the word that you mentioned, or that kind of word picture that you described about even your own experience, the statement that a lot of times for patients and for family members of patients that you can overlay over the entire experience is uncertainty.
Yes.
It's not knowing what can happen. And you want the security, you want the concrete answer, you want the guarantee, or if anything, just clarity, even if it means that it's an update on my diagnosis. I've always told folks, the amazing thing is, when you've been a patient and a professional patient for a long time, you reframe sometimes what resolution looks like, and you'll trade clarity for resolution a lot of the times. So it's different ways to think about it, but the reality is uncertainty is like a companion in all of this stuff. It's very hard to feel that way. Well, when you think about balance, for instance, I always tell everybody the experience that you can think of for folks who are like, I don't know what it feels like to have anxiety on a regular basis. It's not my lived experience. Here's an easy way to know what it feels like. Imagine that you're walking down a set of steps that you've walked down 1,000 times. And for some reason, you're not paying attention or something happens and you miss the last step. You think you're going to hit the ground, but you're not one step short. And as soon as your body lurches, that physical response in your body is pure, unadulterated anxiety. It's saying what's about to happen, and I don't feel stable, safe. I don't have a certainty about how I'm going to land. And everything in your body is hardwired to throw red flags and say, you're not safe anymore. That's anxiety. You're concerned about what is about to happen. Anxiety, by definition, is future tense. What could, okay? So why I say that is if you know that anxiety is hardwired to balance. The research is showing us now that 1/3 of all anxiety patients will develop a full-blown movement disorder. And 1/3 of all patients with a movement disorder will develop a full-blown anxiety disorder. They're hardwired because if you fall down the stairs, you need to get anxious. It's a good idea. Mm-hmm. But if you've got mild debarkment, or you've got a head injury, or you've got all of these other disequilibrium issues, or vertigo or dizziness, you're getting that experience on a regular basis just trying to make it from your car to your living room. So if we know the balance is tied in, a really fascinating thing that I've found with the folks that I get the privilege of working with in the clinic is that if you give them an opportunity in a really safe way to be able to move in space in really intentional ways, but take their vision out of the equation for just a moment, basically closing their eyes, you force the systems that help you to know where you are in space, and you force the systems that help you to exercise that system that might want to spark or spike into anxiety, kind of build some stamina. So here's an easy way to think about it. I do not want people walking downstairs with their eyes closed. That's not what I'm asking for. But doing simple activities like putting on your shoes, right? Or doing something safe like taking a sip of water out of a cup, or brushing your hair, or brushing your teeth. The key is to do an exercise or an activity, a regular activity of daily living that you do all of the time, that if you did it with your eyes closed, it wouldn't compromise your safety, right? But if you do some of those activities with your eyes closed, it takes your vision, which is a huge resource hog. This is why vision is so heavily impacted, right? When you have a 1/4 of all of our glucose and sugar goes to the brain, and 1/4 of everything that goes to the brain goes to vision. Vision is a monster when it comes to a resource hog. But when you look at that, if you do something like trying to comb your hair with your eyes closed, or maybe have a couple of bites of a sandwich with your eyes closed, what it does is it gives your vision a break for just a moment, and it turns on the part of your brain that says, where am I in space? And how do I coordinate my movement if I don't have my vision? Another example, just kind of giving you that preface of, we know it's tied to uncertainty, we know it's tied to feeling unstable, physically, mentally, emotionally. We know it's not understanding what's about to happen or being concerned about what's next. All of those are factors. But a really safe way of doing it, and if you don't feel safe enough to do this on your own, for anybody that's watching, because everybody moves and ambulates and kind of transfers through space at different degrees of skill and capacity. So if you don't feel like you can do this safely on your own, do it with somebody who's there to spot you and watch you. But a really safe way to do it is if you know a room in your house or a space in your house that's got even just 3 to 5 steps that you could take with either a hand on a wall or a hand on the back of a couch, or you could walk down an open area, and if you close your eyes and you're not inclined to fall and you can take a couple of steps, see what happens when you try to transfer just 4 to 6 steps, but you're taking that exact same path with your eyes closed. One of the things that I do in the office that's a really amazing way to show people how the anxiety shows up in their body, in arm swing, in tightness in their chest, in changes in breathing, and heart rate. So I've got a really long hallway. I've got about a 3,000 square foot space. But we'll pick a section of the hallway that's open. I'll have them walk it back and forth with their eyes closed eyes open a couple of times. And then I'll say at your own speed, comfortably, just try and walk from point A to point B, whether it's 10, 20, 30 feet, whatever the case may be. And within 3 steps, their whole body locks up. Everything changes. All of their fascia locks up, their breathing rate changes. And especially if you ask them to walk it at a normal speed, you'll see how difficult it is for them to override the sense of fear that they're no longer safe, even though logically they know that they're safe.
Right.
But subconsciously, it feels like they're falling down the stairs, even if they're standing on stable ground, right? So this is one of those concepts of talking about, well, part of it is, do you need to see a good quality therapist or counselor and process the grieving and the disappointment of being a patient for 10, 20 plus years? That's part of it, right? Do you need to have your family members do that? Because we got to be honest, the people that are caring for the families and the loved ones in our lives, they're carrying a lot too. So there's a part of it of looking at a therapist in a professional setting for the mental and emotional side of it. But for actually giving your brain a chance to exercise some of the real estate that's tied to what's producing anxiety subconsciously, a really safe and really effective way to do it is to do a normal activity in a safe way without using your vision. And a really classic way of doing that is just try and take a walk down the hallway that you've walked 100 times and see if you can do it with your eyes closed without getting a little bit nervous. The more that you do that, and the more you do it in a safe way, like brushing your hair, brushing your teeth, taking a bite of food or a drink of water, the more comfortable that you get with feeling that sensation, feeling your body tighten, your heart rate go up, your breathing change a little bit, and you start to practice, I can take a deep breath. I can have this conversation where I can find where my head is in space and I can button up the buttons on my shirt, or I can put my clothes on with my eyes closed, and I can still remember to breathe, and I can still keep my heart rate down. Then as soon as my body gets into a situation where I well and truly do lose balance, it's going to ask myself, and it's going to ask my subconscious, have we ever been in a place where we didn't feel completely certain, stable, or sure of our footing or our body map and our awareness? Yeah, you've been doing that every day for the last week, putting your shirt on or putting your pants on or putting your belt on with your eyes closed or tying your shoelaces. So it gives it just some degree of data point or frame of reference to go, we've been here before. Let's maybe lower the threat level just a bit, but at the same time react accordingly. Because if you do properly fall down, you're going to know what to do. But if you practice being able to walk a couple of steps with your eyes closed or do some regular activities with your eyes closed, it'll actually build a little bit of stamina and strengthen the system that spontaneously creates anxiety when you don't feel safe or sure-footed, so to speak. The conceptual space in the brain is the same.
Yeah, that's a really interesting exercise. I've actually never really heard anyone like walk you through how to do something like that. And I can kind of see, so like, doing meditation and you have your eyes closed and you're practicing on your breathing. So I can kind of see that overlap there in how that is helping your body build up a resistance almost to anxiety.
The design is to build resilience. And the definition that I give my patients all the time, we actually have a huge mural on the wall just outside my office here that I'm looking at that says, never give up, be resilient. And the definition for resiliency for me is knowing the difference between discomfort and trauma. Now, for a lot of us who have had actual real trauma, the difference between discomfort and trauma is the length of time for recovery. That's really what the difference is. If I go to the gym and I do a workout and I'm sore for a couple of days and I break a sweat, that's not trauma, that's discomfort. That builds stamina, it builds resilience. But if I go to the gym and somebody who did a weekend CrossFit training helps me to do a box jump at 280, which is my size, and I hit my head and I get another head injury, that's not discomfort. That's a trauma. It's going to take a lot of time to recover. So what ends up happening when we do these exercises is it really quickly cues our brain in to go, it's triggering the space that thinks, is this going to hurt? Is it going to cost me? Is it going to be damaging long term? And am I going to end up injured again? The goal is not to create that space. The goal is to allow your brain to engage in a conversation and quickly go, it's not going to kill you and it's not going to be traumatic. It's uncomfortable to take a few steps where you don't feel absolutely certain of where you are in space. But because you did it in a safe way, I'm able to turn on the part of my brain that quickly goes, this is uncomfortable, but it's not traumatic. And the faster that we're able to answer that question, not only as clinicians for patients, like when we're doing intensives, patients will say at the end of the day, 1, I don't like you. 2, this is very tiring. I feel like I'm dying. And then 5 days later, they're like, I have my brain back because it wasn't traumatic. But realistically, if it's not hard, it's probably not helpful. If it's harmful, it's definitely not helpful. So if we can continue to engage in conversations, and this is really hard for patients, it's really hard for me. I'll be totally transparent in my own lived experience. My number one trigger in my experience over the last 20 years is barometric pressure change and rain. And we have had an ungodly amount of rain in Atlanta this year, and it's been very, very difficult. So I have to practice exercises for myself and with my patients to go, how quickly can I really get to the bottom of it and say, this is going to be hard. It's not going to be harmful. It's going to be difficult and uncomfortable, but it's not going to be traumatic. And the more that we do those sort of exercises, like doing safe activities with our eyes closed, figuring out where we're at in space, and then intentionally moving in space without relying on our vision, the more we're giving our brain, our body, our minds, our hearts a chance to go, oh, I can have a little bit of an uncomfortable conversation, develop a little bit of stamina, and then actually curate and cultivate resilience so that when I do have to go in and do an hour-long session with one of the crazy folks like me and all the folks that you're interviewing, they go, oh, I've done hard things. This is not so bad. I've been practicing doing something that makes me feel uncertain every day for the last week or the last month. So it's a really safe strategy just to try and put a drop in the bucket for that part of the brain that goes, how much should I be freaking out? Because I promise you take 20 steps at full speed in a hallway that you know, you're going to freak out. I don't care how confident you are about it. It's weird. But when you get comfortable and practice with it, and then you start to get those data points, so you're like, man, I can do this and not end up being hurt and not end up being uncomfortable. And then all of a sudden your confidence in your own body changes. And my gosh, how many of us as patients have been in spaces where we don't feel confident in our own ability to move in space? It's constantly that conversation of, I don't trust my own body. Well, doing things where you do safe activities with your eyes closed will help you to trust your own body and decrease that anxiety and that threat level pretty quickly. So it's a resilience exercise at the end of the day.
Well, this is actually a really good exercise to give people before they come in for their intensive, because so many people have a ton of anxiety just about doing that week intensive, like, am I going to be able to do it? I'm not going to be able to, like you get in your own head and it turns into a vicious cycle.
It does. And then, you end up being in a space where you're like, oh no, I have some familiarity with this. And then when I get somebody in here, I've got a very, very big, very, very robust professional grade treadmill in here that goes up to 14 miles an hour. And when I get somebody who's been walking at a casual pace in the clinic to start walking at full speed at 3 miles an hour with their hands behind their back and their eyes closed and they're crushing it, that's a big step, right? I'm not recommending that people go, yeah, I think I'll just try the treadmill and figure out how it goes. Not a good idea. That is not what I'm saying. But when you start to go, wow, no, I can actually get comfortable with the concept of what it looks like to even just get dressed with my eyes closed. And then I come into the clinic and I work with somebody who knows how to do this like I do and like a lot of the other functional neurologists do, to create similar environments where we maybe will increase the intensity and we'll increase the duration, we'll increase the frequency, how strong, how long, and how often. I'm saying right now, gauge for yourself what feels like it's strong enough to make you a little bit uncomfortable but not terrified.
Mm-hmm.
What's long enough for you to feel like it's something that you were able to get a gauge on and you can figure out what the length of time is. Is it 2 steps? Is it 4 steps? Is it just the shirt, or is it shirt and pants? Is it the whole meal, or is it just 2 bites? So look at how long you're doing it for, how often you're doing it for, and how intense you feel during that activity. Because you can get a really quick gauge even without necessarily going through a whole intensive, and this does not substitute in any way for clinical care.
Right.
I'm just stating that if you go into a space, for me as a provider, one of the things that I do for people during the intake exam is I'll actually have them, like most people are familiar with dual tasking, where you do something like counting or serial sevens or other stuff. I'll actually have somebody take a couple of steps with their eyes closed to gauge how quickly does their anxiety spike. Because if I don't know that as a provider and I start pushing them into some pretty heavy duty funk neuro exercises, like, somebody can get really uncomfortable really quick. And if you can get uncomfortable, really spike, and we specialize in panic attacks sometimes too. I do, and I say we as functional neurologists. I specialize in panic attacks and anxiety attacks. If I don't know up front before I really dive into the deep end with somebody that they'll spike just on trying to take 5 to 8 steps with their eyes closed, as a patient, before I go in with a provider, if I know that it's really, really hard for me to even think straight or to remember to breathe, or my panic goes through the roof if I try to do one of these basic safe activities, that's a really helpful data point to share with your provider before they start with your therapies, because you already know that your anxiety spikes doing things where your vision isn't there. And that's going to be a huge resource for knowing what to do in terms of therapeutic interventions during, whether it's 1 hour of work or it's 20 hours in an intensive. Right. Really helpful piece to know for you as a patient and also for the provider when they connect with you. So different things to think about, but it's just coming back to that concept like we talked about at the beginning. If you feel uncertain and you don't know what's happening with your care and with your recovery, exercising the muscle that allows you to navigate what you do when you don't feel stable and you don't have a degree of certainty and you don't feel like things are concrete will help you to build some stamina on how to handle anxiety, because anxiety at the end of the day is not feeling like you have clarity on what's about to happen. Doing stuff with your eyes closed exercises a part of your brain that goes, I don't have clarity on what's about to happen, but doing it in a safe way.
I'm going to try brushing my teeth with my eyes closed tonight. Well,
just for just one piece for liability and safety. If you don't feel safe doing it standing, do it seated. Okay? Do it in all of a sudden you're like, I don't know where I'm at. You're already in a chair. Okay?
Right.
Put it in a safe way for me, please. But if you don't feel safe brushing your teeth standing, now's the chance to try seeing what it feels like to brush your teeth sitting down. It's all okay.
I've done the whole brush your teeth with your non-dominant hand, and that's a lot harder than you think.
Try doing it with your dominant hand eyes closed and your non-dominant hand eyes closed and be like, this is a whole different ballgame. So it's easy ways to kind of exercise those systems. So I appreciate the chance to share that with you.
Well, thank you so much for being here and being a part of these concussion discussions. I know that people watching this today are going to take away some really valuable information that's maybe not talked about enough, right? The whole anxiety issue. So thank you so much for being here. And I know you also are available for a consultation for anyone who is interested. And they can find that at thriveneurohealth.com, correct?
That's it. Absolutely.
Awesome.
And thank you for the opportunity to be with you. I'm grateful.
And we will have that information right underneath this video for you guys so you can click on it. So thank you again for being here today, Dr. Jerome Lubbe from Thrive Neuro Health.
Thanks so much, Amy. I appreciate it.